Hello, I'm Dr. Maran. I'm a GI endosurgeon and a bariatric surgeon. So today I'm just talk about tobacco and its side effects. So everybody knows tobacco definitely is injurious to health. Tobacco in any form, chewing, smoking, or in powder form, anything is definitely injurious to health. Everybody knows about tobacco causing cancer, but most of us may not know the small or even instead of mortality, morbidity arising out of tobacco. So tobacco has 45 known cancer-inducing substances, out of which 19 are very serious one. This is one main thing. Apart from that, tobacco in any form like chewing, smoking, or even snuffing, as you know, it can stain your skin, it can stain your teeth, it can have a bad odor. Tobacco smoking or chewing can dry up your mouth. When your mouth dries up, you can get ulcers. Your protective mechanism goes, so unwanted bacteria can grow. You'll have a bad odor, even leads to ulcer, mouth ulcers. Even caries tooth can arise because the normal flora of the mouth is destroyed. Then the tongue also has been coated with nicotine and other substances. Because of that, major taste buds can be destroyed. Because taste buds are destroyed, you may not have a particular taste, your appetite will come down, your digestion may not be proper, and it can lead to loss of weight also. Then from there, if you go down, from mouth to you go down, it can affect your voice box or the what we call the pharynx. So this is the throat level. It can give you chronic irritation because of the smoke, or because of the juice, or because of the unwanted chemicals. So these can give you chronic irritation and chronic cough, and when you go a little more down, you can get ulcers in the stomach, or even ulcers in the foot pipe. You can have acid reflux. Mainly your digestion becomes a little sluggish. Most of the people have a opinion that smoking increases good digestion. It's not like that. People have certain myths about smoking. They think smoking increases their bowel movements. See, the bowel movements, smoking and bowel movements has no direct relationship, but it's purely psychological. Plus anything warm. See, like if you take warm water or hot tea, it increases the bowel movements. The same way, when you smoke, the warm air goes in, it can stimulate your intestine. So probably you may have a normal bowel movement, but it has got nothing to do with your regular intestinal movements and bowel movements. Then most of the people think digestion increases, smoking increases, or even chewing increases, tobacco chewing increases the digestion. Again, there is no relationship between smoking and digestion. In fact, your digestion will come down because of the smoking. Most of the people, especially youngsters, when they feel hungry, especially like 11 o'clock in the morning or even 4 o'clock in the evening, they smoke, they take tea, and along with some oily substance like bhaji or vada. So this smoking, oil and tea is a very bad combination. Instead of doing good, in fact, it won't fill your stomach, but it suppresses your appetite. You don't have appetite, so you feel that you are not hungry, your stomach is full. It's not so. Actually, your stomach is empty. Tea is nothing but tannic acid. Coffee is caffeine. They can directly irritate your stomach. Smoke, whenever the hot smoke, the tip of the cigarette has 800 degrees centigrade heat. So the tar or with the chemicals, 800 degree heat, when it goes in, they can directly injure your stomach lining, the protective lining. Everybody has a good protective lining in the stomach, which can be easily destroyed. So you're prone for loss of appetite, you're prone for indigestion, you're prone for ulcer, you're prone for cancer. And smoking has also got other side effects. It's probably Also increases the chance of cancer compared to a normal person. The cancer to the GIT is increases by 4 to 5 times, especially oral cancers, your tongue cancer, even your throat cancer, your foot pipe cancer, your stomach cancer, pancreatic cancer, especially urinary bladder cancer and kidney cancer. In women, they are more prone for cervix cancer and uterus cancer. And smoking also increases the chance of impotence or erectile dysfunction in young people. Longer the duration, younger the age of smoking, it increases their impotency, increases the erectile dysfunction. In women, equally, they can get they are prone for miscarriage. And apart from these things, tobacco also affects the small and medium sized blood vessels. When the small and medium sized blood vessels get clogged, you can get stroke, you can get heart attack, and most of the time you lose your limbs, upper limb or lower limb. You have to amputate because of the clogging. You can get gangrenes in the upper and lower limbs and you lose your limb. Suppose you are going for any surgery, especially a surgery involving general anesthesia, you are supposed not to smoke, because immediately during the surgery or immediately after the post-operatively, smokers have a high risk of respiratory tract infections, which can lead to pneumonia and death. So that is why most of the doctors, they at least you have to quit smoking 2 weeks prior to surgery. Especially major surgeries, they say minimum 2 weeks. Even after the post-operative period, they will give more chest physio, they will ask them to cough more to bring out whatever the phlegm. They are more prone for respiratory tract infections. And smoking also delays your wound healing. If a normal person gets healed within 7 days, if you're a smoker, the healing takes 10 to 11 days. So suppose you're going for a hernia surgery. So hernia is a surgery, most of the time you are not supposed to smoke at least 2 weeks before surgery. Even after the procedure, you are supposed not to smoke for at least 3 months, because the healing depends, the suturing, healing, everything depends upon your nicotine level. Smoking and ulcer has a special mention, because nowadays all the youngsters are all smoking and they have a very stressful life, and usually they skip their morning breakfast. All these combined together, they smoke with tea and oily substance. It usually produces ulcer. The ulcer is nothing but, most of the people think ulcer is something different. See, ulcer is nothing but, suppose you have a cut in your hand, that's called ulcer in the hand. Same way, if you have a cut in the stomach, that's called ulcer. Suppose you smoke and you keep the smoke on this cut wound, definitely the wound will not heal. The same way, if you smoke, the smoke when it goes in, the wound will not heal, the ulcer will not heal. So you will have a non-healing ulcer. This smoking, when it combined with the tea, coffee or oily substance, or especially with alcohol, the chances of getting ulcer rises to at least 20 to 30 times. And they are the one more prone for cancer stomach. The ulcer, usually people think ulcer means they will have a stomach pain, but smokers with ulcer, usually they will not have any pain at all. They will not have pain at all, unless otherwise it's a very serious one. Usually their presentation is always, they will say they have a bloated sensation. Even with a small amount of food, they feel full. They may not have pain, but they will have a discomfort, belching, they have a reflex kind of thing, or even loss of appetite. Loss of appetite is also a sign of ulcer. And ulcer also, because of the ulcer, you may have a vomiting sensation, especially when you brush your teeth in the morning time. You will have a nausea kind of thing. These are the main symptoms people who smoke with ulcer. Most of the people say quitting tobacco, especially smoking, is very difficult. The reason being, most of the time they say, doctor, I was all right when I was smoking, but when I quit smoking, now I feel all the problems have started. These are usual way of their expression. The reasons behind this is, when you're smoking, as I told you, the tip of the cigarette has 800 degrees centigrades, and it has almost more than 4,000 chemicals, out of which 45 are known to cause cancer and 19 are very serious cancer producing substance. When the heat with these chemicals, with tar, goes into the lungs, most of the time you can say 80% goes to the lungs and 20% goes to the stomach. So when it goes to the lung, anything, any foreign body or anything abnormal goes into our body system. Usually we have natural filters. Lung has a natural filter. This filter, they filter the chemicals, tar and what other substances they go in. And the lung also has to expand and collapse during the inspiration and expiration. It has a thin film of watery substance, a pleural fluid, which acts as a absorbent as well as a lubricant. When the toxic substance they go in, they filter the toxic substances and the unwanted substances. Over a period of year, these tar, the chemicals, the unwanted substances, when they go in, they are getting filtered and they get laid, they get trapped in the fluid. So the fluid, which was very thin, becomes more thicker and thicker. So suddenly, when a person quits smoking, there is no heat is going in, and no substance, no chemicals also goes in. But when there is no heat goes in, this molten liquid becomes more thicker and thicker, makes them difficult to breathe, and they start coughing. Cough, sneezing, vomiting, these are all not diseases, they're all protective mechanism. Cough is a protective mechanism. Anything abnormal goes into the lungs, you cough and you bring it out. Sneezing, through nose, anything goes abnormal, you sneeze it out. The same way, now there is a thick chocolate-like fluid trapped in the lung. Now the body wants to expel it. That is why we are coughing. Especially after 1/3 day, most of the people say, first 2 days I was all right. After from 3rd day onwards, it's very difficult for them. They keep on coughing to bring out the thick chocolate-like trapped chemicals and tar. When they're smoking, whenever they smoke, the heat goes in. So after 3 days, usually what they do is, they start smoking. When they smoke, they feel very comfortable. The reason is the 800 degrees centigrade in the tip, the heat goes in. When the heat goes in, the thick chocolate-like fluid melts and it becomes more liquid. So they can breathe easy. So their cough comes down. That is why most of the smokers, they say, we'll go and have oxygen. They won't say, I will go and smoke. They say, I will go and have some oxygen. Because they feel easy to breathe. Their cough comes down. So this is something like, masking the abnormal symptoms. It's not they are normal, they are very comfortable, or they are very good. It just it masks the abnormal symptoms. So usually that is why after 3rd day they start smoking. It's very difficult to quit smoking only for this reason. They have a cough and they have a breathing difficulty. Since they have a breathing difficulty, their oxygen level goes down, they feel tired. Then they smoke, they get the refreshness, but it's only a temporary one which masks the abnormal things. That is why they come back again to smoke. So usually to quit smoke, the smokers who quit smoke are all just like that. They are the one who quit, they are the one who quit smoking. The one who says, after 1 year, after the new year, I will quit smoking. On my child's birthday, I will quit smoking. Or I will have electronic cigarette, then I will quit smoking. I will reduce the number of smoking, then I will quit smoking. They cannot quit smoke. Those who they say there is a patch, nicotine patch, I will quit smoking. Chewable, bubble gums are available. Those who try all those things cannot, or I would say 99% of the time, they cannot succeed in smoking. The one who just like that quits is the one who quits smoking.